Good afternoon, everybody. Wynn Brown here with Heywood Healthcare's weekly update for Friday, July 16th. I'm actually in Bob Flade's office. We're going to have a conversation a little bit after I go through some of the updates. Bob is our Director of Emergency Services, and he's going to give us some updates on things happening in our ER here and also at the Athol campus as well. So just before we get to that, just an update for COVID. We have actually one inpatient who is COVID positive. Want to let the community know that the Delta variant is present in our community as well. And we're seeing some breakthrough infection. So got to be super careful out there, and we encourage everybody to get vaccinated, which brings us to our staff. We expect to be making vaccine mandatory for all staff probably around October 1, if not before. So we're encouraging all staff who have not yet been vaccinated to contact employee help. The number is here. The extension is 6545 to get yourself scheduled well in advance of October 1st. So appreciate the staff who have not done that yet. If you have questions about the vaccine, any of our providers, any physician or APP on our staff are happy to talk with you, or anybody on the senior leadership team as well if you'd like to learn more about the vaccine if you have some outstanding questions. And just another reminder to staff about our patient first parking, especially on the Heywood campus. We are seeing some staff park in visitor parking, which then forces our patients to end up in the Ringe lot, as we call it. So make sure you're parking in the right place, and also at the south entrance, which is tighter parking, make sure you're parking in the employee parking spots. And we're going to have security up there doing their rounds more regularly as well. Just some upcoming events. Our Ride for Your Life motorcycle ride for suicide prevention is August 22nd. And there's a click to register and to sponsor on this as well. And then the Watkins Faust Golf Classic, September 27. And then the Athol Golf Classic is October 4th. And Governor Baker's weekly update is here as well. But while we're here in the ER in Bob Flade's office, I'd love to hear a little bit about what's going on in the ER, some of the new things that you're doing, and projects you're working on.
So we started a daily report card that goes to our leadership team. I'm sure you're aware of that.
I get it every morning.
That looks at statistics from the patient's perspective. Obviously, if we're not meeting the patient's needs, we have no business being here. So this report card breaks down some basic statistics, plus looking at lengths of stay, things like that are important to patients. We're doing this both at Heywood, and Christine's doing this at the Athol campus. And we've created 3 teams so far for looking at that data and figuring out what we will do to improve our throughput times. Throughput is the biggest predeterminant factor for patient satisfaction. So we want to make sure that we're doing things safely, but that we're moving at a clip that we can turn patients over. It's also very important for our coworkers. We had one day where we actually met our goal last week of less than 90 minutes, compared to the goal, compared to the results so far this year of 170 minutes. And that results for coworkers in literally having half the amount of patients in the emergency department at any given time. Because we're turning them over faster. You think about how fast a table turns over at McDonald's versus going to Ruth's Chris Steakhouse. So if we can turn those beds over faster, we can see more patients in the same period of time and have less people in the department at that same, across the day. So it's a win-win for everybody. When we've done this at other emergency departments and achieved those goals, our coworker satisfaction increases, our patient satisfaction increases. So that's one of our biggest focuses that we're doing right now.
Okay. And how is the ongoing pandemic affecting the ERs? Obviously throughput is one of them, but are there any other things that we want staff or the general public who also sees this to be aware of? Are there any tidbits there you want to share?
Well, knowing that the general public sees this, which I wasn't aware before, certainly that the emergency departments are open, we are safe to receive care in. If there is anything going on, do not delay care. We did see in the beginning in all EDs in the United States that people were coming in days later after having strokes or heart attacks.
Right.
And at which point it's too late to do anything. So if you have any concerns that you need to receive care, please come in. Know that we are keeping the department safe by limiting traffic through our departments, by our cleaning processes. Do not delay.
Right, do not delay, because
It can mean a life.
It can mean a life and other things. So thank you so much for taking a little time. Great to be in your office, my first time in your office since you've joined our team. Appreciate the great work that you and your colleagues are doing, taking care of not only of your colleagues, but the community as well. So that's our update for today. Have a great weekend.